we are going to move to our next session, which is our first panel of the summit. This hopefully will address some of the questions that are coming up. This is our Pathway Innovations panel. So we're going to be answering some of the questions that you all submitted during your registration process. And we're hearing today from our panelist, Cherith Smith, who is the Director of Experiential Education and Clinical Assistant Professor at the University of Montana Skaggs School of Pharmacy, Dr. Alberta Arviso, who is Senior Engagement Officer at the University of Arizona College of Veterinary Medicine, and Amanda Gilliland, who is Nursing Lab Manager and Faculty at Salish Kootenai College Nursing Program. And our excellent moderator today is Dr. Melanie Nadeau, the Vice Chair of Indigenous Health at the University of North Dakota. Thank you all so much for joining us. And does everyone have everything they need for this panel?
I believe
Wonderful.
so.
Okay, thank you so much. I'll give you the floor.
Awesome. Greetings, relatives. Bonjour, Melanie Nadeau, Jawani Gijugoikwe Indigenous Cause, Mukwa Ndudum, Miknakwaju, and Dujabar. So I'm from Turtle Mountain, down to Chippewa Indians. I'm happy to be your moderator today. And it looks like we have plenty of participants on. And so I don't know at this point if you'd like to do further introductions and share a little bit more about what you do. So I'm going to just go in the order that I'm seeing on our sheet here for the panel. And so I'm going to pass it over to Cherith.
Amadakiape, Ambituaste, Cherith Smith, Imachia Pikasto, Sichango Oyate Awate, Malakota Kasto, Chante Waste, and Nape, Chiazapi.
And Alberta Arviso.
Good morning, good afternoon, relatives, colleagues, community, tribal leaders. I'm just really, really grateful to be here. Halsoinish toihet lini bashishin, nanisht eje dashiche, tradisane dashinele, le the nebekayat eyahe, jishike do shnanishnat eyahe, old kapatzil, eyahe shnanishola. I'm just really happy to be here, so I'll pass on to Amanda.
Hi, so I'm Amanda Gilliland. I'm the Experiential Learning Coordinator for Salish Kootenai College. I am not tribal, but I was born and raised here on the reservation, and I actually am a graduate of our college, so a lot of experience with the culture and stuff. But I'm just excited here to share what we're doing to help our students excel and grow in the health profession. So.
Wonderful. Chi miigwech you all for being here. It's so wonderful to be a part of this conversation, and I'm really grateful just to be moderating this conversation. And so I have a list of questions here that were sent in, and I'll just go down the list and invite whoever'd like to speak, just let us know, and we'd love to hear from all of you, of course, but I'll let whoever wants to answer the question come forth. So the first question is, how does your program support recruitment, retention, and transition of American Indian and Alaska Native learners, especially tribal students in remote areas?
I'm happy to share what we're doing here at the University of Montana through the Native American Center of Excellence. I too was a student who was recruited to our program here many, many years ago. But one of the things that I try to help create a culture of is that understanding of connection, kinship, relationship that is so critically important, and being able to create the extended family when our students are away from home. And so we do a lot of traveling, a lot of outreach whenever we can get out into our tribal communities to build those relationships. We are out there. We have a tribal colleges tour that just happened last week. We'll have another one here coming up and in the first couple weeks of April. And then any chance we can get out in the community and bring some of those services that we provide. So I partner with some of our additional services we house within our College of Health, including improving health among rural Montanans. That way, as we are out in our rural communities, we're able to provide some clinical services, provide some hands-on science education, and then incorporating that here on campus. I think the main thing that we have done is really listen to our students who are arriving and hearing what they are struggling with. So one of the services that we are currently providing includes Wellness Wednesdays. We have a drop-in psychologist with social workers who provide drop-in counseling. At the same time, we have our partnering well-being coach, a lifestyle coach present during the same afternoon. And then I'm just creating hopefully a space that's welcoming where I provide some ethnopharmacology, traditional medicines processing that leads into a craft night where we provide some wellness education, but really it's just to build those social connections. And of course, there's a lot of other things that we do, but I'll hand it off to some of our other speakers. Thank you.
Thank you so much. I just want to build off of what Cherith indicated in supporting and recruiting, retaining, and also working with the transition pieces of when working with students. And at our university, I first became involved with the projects having to do with just focusing on the health professions programs and building support and also a structure to where students can utilize the services once they get to the university level. But to actually recruit, we get out into the communities, provide a lot of hands-on experience as well as a lot of clarity around the professions available. I've been involved, fortunately, and just really grateful to be involved in the areas of students going into medicine, veterinary medicine, and then also psychology. I'm a psychologist by training, so I'm affiliated with different communities that embrace these professions because we have mentors that are have their degrees and they've been working in the field as a professional, a health professional. So providing a lot of that outreach with the students and then I guess when you look at recruitment, being able to partner with high schools and then also the community leaders and with the tribal community and helping them with contact information as well as like handouts as to what the pathway looks like from a smaller just entry into the professional level. Kind of, I like to look at the circular level because that's the way our Native Indigenous backgrounds are. There's a cycle. You begin and then you reach that endpoint and then you begin again. So it's really important to utilize those concepts within our culture, embed them within the structure that we are working with, and then providing a lot of support around the different ways that students are engaged with the university and then answering their questions and having them be part of the process. What is it that they would like support? It might take some time to get there because sometimes the trust, the rapport has to be established with the students or the community, then eventually getting to the study skills and then really breaking that down. And again, within my profession, I was fortunate to be learning specialist, so I could be fully engaged in the learning part of the process for the students, really looking at study skills, time management, social support, and then even looking at community resources and spiritual resources. And that's a real strength, an area that we all honor is our upbringing, the spiritual power, the ways that we're connected to the land and our community. How do we transition from that into an environment that is a lot of activity academics, a lot of classes that are getting more advanced. But then, I heard a lot of confidence building from the other presenters. So I think just interweaving that and exposing that and being able to lead off of it to really help the students. And the learning part of it is my favorite part, because students develop confidence and they realize that there's so much gift that they bring, so much strength that they bring, and helping them recognize that self-awareness to really engage and become a strong individual. And I love what was said before, is teaching students that they're leaders when they're very young, so that they build that every year as they move forward. And again, thinking in seasons, as they grow and develop. So I'll stop there and pass to Amanda. Thank you.
Thank you, Alberta. Yeah,
Mm.
we for as far as recruitment goes, we do a lot of that hands-on reaching out as well. We tend to do some hands-on tours where they get to come in and practice nursing skills and tour the building, see all the opportunities that are presented here at SKC. We also specifically try to reach out to other high schools at other reservations in Montana, offering times to meet with the students, whether it be via Zoom or if we can make a tour out to those areas. As far as retention goes, specifically for the nursing department, nursing can be a pretty rigorous curriculum. And so just creating that family supportive dynamic, building that, Alberta mentioned, you had to kind of build that rapport and then let them know that we are here for you. Open communication, respect, and then just also educational support. We have dedicated tutors for our program to ensure. And then we also kind of revamped our curriculum. Since 2020, we've actually went from an ASN program to a BSN. And so just advancing so we found that a lot of our ASN students didn't return to get their BSN or didn't move on. And so if we can just kind of get them there in one fell swoop, they're much more successful, opening up much more doors in professionalism, opportunities to move on into advancing degrees. But we also revamped our program to have more hands-on learning. It meets kind of the needs of our students. They learn better with hands-on. So we increased our experiential learning hours to about 900 hours in the bachelor's program. And that includes like skills lab and then simulation and clinicals. And they experience clinicals on the reservation, working with our local hospitals, with IHS, and then also in larger facilities just off the reservation in Missoula and Kalispell. So they kind of get a diverse variety to see the opportunities they can excel. They also are involved in health promotion projects. So they get to do, as a senior, they meet with a local health representative and they discover the needs of the community and provide different presentations that way, whether it be to the youth or adults, just meeting those needs. We also have a Wellness Wednesday, Cherith, with our I can't remember the name of their department called, but where we do have people that can come in and grief counselors and stuff. And then we also have a success coaches, where we, as faculty, we reach out to our students a lot. Hey, you missed an assignment, you have this much time, you got to get it in. Let me know what we can do to help you get there. But we also report to the success coaches and they also help kind of track, and they can track across the entire student's education rather than just one or two courses.
Awesome. So wonderful. Thank you all for that. I just wanted to reflect a little bit, but just, seeing some of these things that you are all doing, you don't see that in the mainstream academic settings, right? And so having these, craft nights and spiritual resources. Oh, I just love that. That's so powerful. And talking about the circle and how we always come full circle and we're lifelong learners, right? And we're continuously learning and growing. And And I just really appreciate how all of your programs are really not only responsive to the needs of the students, but you're also responsive to the needs of the community, which I think oftentimes gets lost in mainstream academia is, really keeping that connection to community and being responsive community. So you're all doing such wonderful work. And then this idea around, the seventh generation principle and the land and our animal relatives. And so it's a different worldview and a different concept. And so you're providing some very supportive environments. Uh, the next question is how can we help K through 12 students learn about pathway options and healthcare careers? And I'm going to kind of add on a little addendum to that and ask, because we were just having a conversation over here in my program about this yesterday, is because current students are just so busy, but a lot of times, the younger students want to hear from the students that are like once removed from them. And so if there's any initiatives of having current students involved when you're going out, helping K through 12 students learn about these pathway options and health careers, if there's other student involvement with those activities. And so we'll just complete our circle again. So we'll start with Cherith.
So we've done a lot of different things over the years and with different age groups as well. Some of the pathways that we have taken have primarily been initiated by the tribal communities who have asked us to come out and be there. But I think one of the biggest things when it comes to our young people is that exposure and the connection that brings them something that they can resonate with, they can feel like they have a connection to it. And so when it comes to pharmacy, I work with our local Missoula County Public Schools Native American Student Services program. And part of their request has been teach us more about nutrition education, what the pharmacist role is. And so what I do is then I bring in our traditional and ecological knowledge in sharing the indigenous food systems within the school system to help bring in that connection. We've invited them out to be able to participate in, for instance, just basic science. And it might be processing bison fat and then discussing fats in general, but then being able to then help them understand that as Native people, we have been scientists, we have been healers, we are continuing in our contemporary life in these same systems and ways of knowing. And now there's a pathway where we can bridge and connect those two together through our pharmacy program. But I would say hands-on has been the most receptive, and that's what we're requested to do. So it might be, for instance, going up to the Blackfeet Reservation and providing hands-on compounding education. So we might compound a chapstick, for instance. It might be going to a North American Indian Days youth event that leads up to the powwow and just providing a station on screenings for parents, but then activities for the youth. When it comes to our high schoolers, I have found the best way to engage with them is when they are active and busy. So we might partner or collaborate with, for instance, having a basketball camp. And then part of the basketball camp is providing some education, some hands-on activities related to the pharmacy pathway or pharmacy careers. So just a few examples of what we do out there. And I will share that mentoring is incredibly important. Whenever we can bring our fourth year pharmacy students out there, we will bring them as well to help to provide some of the activity facilitation. I'll pass it to Alberta. Thank you.
Thank you. There's so much. I just love what Cherith mentioned, but I would like to add on kind of through the stages, the programs that I've been a part of that I can best speak to. The K through 4 program, I was involved with a project to where we went into the community where the elementary schools are, and we were able to engage with the students. For instance, veterinary medicine, we brought information involving the students. Okay, veterinary medical students, trained them around cultural humility, cultural fluency, and being able to know that they're going to be working with children in a community on the reservation or just in an under-resourced community where you have families, you have community members are also going to be in the audience. So training veterinary students and then bringing the veterinarians as well to all volunteer time. So there's a sense that you got your busy study load, but then you're also able to give back and you're also able to share some of the knowledge that you're learning. So we developed a curriculum that K through 4 students simplifying the information, a lot of hands-on. And then the students get to really get into the role of a veterinarian. And we kind of designed it kind of story-based so that the veterinarians are heroes. They come in heroes and they help animals and really simplifying the language to make the students really excited about it and really curious about what the profession is about. And then we illustrated some of the anatomy, some of the different skeletal features, some of the, what the whole process involved in what the veterinarians is. And in the process, they get to utilize a stethoscope, they get to put on scrubs. We took scrubs in different sizes. So the students put on scrubs, they get into the role of it. And then they also have a lot of the story, kind of storytelling, and then games out of it. Like we incorporated Simon Says into the game. Simon Says, touch your femur. And so we had to go on and on like that. So that one way is a story base and then language, and then also simplifying the information involving some problem solving skills. And then in the middle school, we utilized like a horse camp again, what Cherith mentioned, the designing a program in the community that the students can relate to, but then utilizing the language and the culture in a design that is providing veterinary medicine. And you get to incorporate medicinal plants and the ways that traditional healers are involved with the process, and then how they interface with modern medicine and utilize some of the sources that are within both cultures so that students really get curious, they get excited. Again, they have a lot of excitement about this. And then having them volunteer for roles. I went to a school where the students welcomed me. So they let me in. They took me to where I was going to present. They gave me snacks. They gave me water. They even came up and took my trash. They said, "Where's your trash? We're going to collect this." And so really assigning students responsibilities. And then for some of the seniors, some of the best work I've seen is summer programs, like a 6 week living on campus or a 4 week program living on campus, getting to tour many of the different professions that are available and doing some active involvement that really gets them to build their insight about the different professions, nurse.
Alberta, you accidentally hit your mute.
Okay. Can you hear me now? Okay, so those live in on the university. Then at the professional level, now that I'm working in a doctor of veterinary medicine program, we've designed a pathway program where students can participate during the summer sessions. Again, hands-on observations, service learnings, and interacting with veterinarians, both in the field and then also classroom experiences. So there's a whole range, and then I think making age appropriate, and then also educationally where they're at and what they need, and really listening to them as well. What is it that they're lacking? Do they need to build their GPA? Do they need to build their social skills? Do they need, have them start looking at resume building, and then keeping journals and how to organize the material that's about them, vision boards, that are very a learning process for them. So, and then a lot of mentorships, engaging mentors, especially Native American professionals. We have them out there, and they're really happy to give back, and they tell their strength as they tell their story about how they made it through the program, what the challenges were, how they've overcome it, and how to continue and flourish in their professions. Okay, I'll stop there.
Yeah, I think Alberta made some really great points. Just meeting the students where they're at developmentally, right? And that exposure. I would say recruiting people to healthcare and nursing specifically is a bit of a passion of mine. When I was going through school, I was never going to be a nurse. And that stemmed from really just not understanding the profession. And so starting with those younger elementary age students of just exposure, showing them the fun things, what it is. And middle school, you have a little more increase in the development, and so you offer more hands-on stuff. Start talking to them about opportunities where they can go. This is a possibility, right? A lot of them don't see it as a possibility to grow and into those professions. And so I personally feel that SKC provides that great opportunity because we have a lot of great associate and bachelor degrees that get them that transition from maybe not the strongest high school education into higher level degrees. And so just helping those students understand that these are opportunities you can do and they're completely achievable, and there's this support there to help them get there. We do a lot of outreach, more specifically to middle school and high school. Middle school, we mostly focus on the hands-on, fun things, that kind of stuff. And then in high school, we focus more on the career opportunities, letting them know the availability. I love that we can encourage them to stay here and practice in our local communities, but also sometimes letting them have the opportunity to go elsewhere. Healthcare can kind of take you anywhere and give you a profession, and then maybe you can gain your experience and come back and further serve their communities. So just, I guess, educating them, teaching them, showing them that this can be their reality, where a lot of them don't understand, and then helping them understand that the support is there. We engage a lot of our students in that outreach because, as you said, we'd like to hear from those who are currently experiencing it. Our students have a lot of feedback on the support of the staff, kind of meeting our students where they're at and getting them where they need to be, that kind of stuff. So just showing them the achievability of it.
All right, wonderful. And just to reflect a little, really appreciate the sharing of around traditional ecological knowledge and how that is such a foundational piece of the learning pathway, the processing of the buffalo fats and then translating that at the nutritional level. I think that's, food is medicine, right? And thinking about the horse camp and our horse relatives and how healing they can be on these pathways. And another thing that, I really appreciate that you all brought up is how a lot of the initiatives that you're doing are family focused. So it's not just about, our student relative, it's about the community that they bring with them into that, along their journey. And so making space for the family is so very important. And then the hands-on. And I love the fact that, you mentioned that our ancestors were always scientists. We were always researchers, and reconnecting and really bringing that approach into your programs, utilizing a two-eyed seeing approach where you're integrating those Western and Indigenous methodologies, not only in practice in academia, but showing how that can translate out into the field. So kudos to you on all of the wonderful work that you're doing. The next question, in your opinion, How can we better support American Indian and Alaska Native students in their residency application process or otherwise continuing their academic careers beyond associate's and undergraduate degrees?
So I'll start by sharing that here at the University of Montana, I have an opportunity, and I'm very blessed to be the director of experiential education, which means I am following and interacting our fourth year Doctor of Pharmacy students for their entire final year of the program through their clinical experiences. And so what that allows me to do is to bring in former graduates who completed residencies or who are in the middle of residency. We have opportunities to have layered learning within the clinical sites for those fourth year students so that they can think about residency. And then basic skills, for instance, developing their CV. I'll start that early on in their didactic curriculum, where we start with a resume. And as we move through each year, then having them just build on that, being able to help guide some of the things that may seem difficult when we think of them in the whole picture, but if you break it down bite size and you're walking with them through that process, semester after semester, year after year, it tends to be what I would say our students are more successful. We just received our match rates back, and we have almost 100% residency match rates, but it wouldn't be there if we weren't exposing them early, exposing them often, and ensuring that they have the tools, the resources, and the skills needed to have successful residency interviews. So just a few ways. I'll pass it to Alberta.
Mhm. Yeah, thank you for mentioning those areas. And when I think about engaging students into a residency and keeping on the pathway of higher education, looking at career fairs and preparation for that, and really building on their relationships with their mentors. Multiple mentorship is really important because they can find an alumni, especially again, Native American alumni are out there as nurses, physicians, veterinarians, and being able to pair them and bring them into the circle so that they provide some supervision as well as guidance. And having that opportunity, then utilizing our own relationship as Indigenous people, being an auntie, a grandma, a cousin. Those roles are very important because in some of our families, when the uncle provides a lot of guidance, support, it really helps our children. For some, it may be grandma and grandpa. For others, it might be their step families or their adoptive families and foster families, whomever the caretaker is, and really knowing that. And in academia, I really lean on the Native American professionals as well as the alumni, helping them just come into the learning of the student that continues on a pathway of residency or into the advanced degrees, and even specializing. Today, we do have people out there that are our Native folks are specializing in very exciting fields like neurology and neuropsychology. So to get that guidance, I also lean on the professional organizations like for veterinary medicine, the American Association of Veterinary Medical Colleges, and then also the American Psychological Association. We also have the American Indian Physicians Association, Society of Indian Psychologists. So I utilize those organizations to help students become members, student members, and then they're part of mentoring. They have mentoring available within those organizations. And then also tribal colleges. Oh, my heart really goes out to tribal colleges because they lead in the area of being community-based, tribally designed, and then also really having the position to where the students can really start their education. So policy development here at the University of Arizona, we're developing partnerships that's guided by the consultation policy that the faculty and the community tribal leaders designed for the university. And then we engage with the process, and we want to make sure that sovereignty is respected and honored, and that there's government to government relationships in building that course equivalency guidelines so that tribal courses can be smoothly transitioned into the university setting, whether it's a 2-year college or 4-year, because some of our tribal colleges are 4-year and they offer bachelor's degrees as well too. And then really forming that partnership, and then also making those connections for the students, getting student input so we can have student voices as well as tribal leadership voices, and parent voices are all really important to the process. So I think those are some of the continuing ways that we can engage the students that are really at the advanced levels. And then also that mentorship, I mentioned spirituality. That's an area, I come from a long line of traditional healers. So I feel it's my responsibility to be able to help students. Sometimes just out of I'm involved in my own day process. I might think of a student and then I reach out to them. And then all of a sudden I realize I was thinking about them because they were having some problems financially or health or something. And then the beauty of social media, you can have Zoom calls, you can have keep in touch with them in ways that go way beyond where I, as one, started was mailing letters and having to um, find a phone to even make a call, or even leaving a message at the tribal police office so I can be found or my family can be found. So we've really gone from that to where social media, and then also Zoom meetings, all of those are very helpful in helping us track and support students. And I think having those kind of available networks for students where they can find out that they're not the only grad students, they're other grad students. And then when you put them together, they find out that some of their, like maybe writing their dissertation, writing their thesis, trying to get through that. And when they hear stories from one another, then they realize, oh, okay, I'm not the only one having this problem. So it really generalizes some of their areas of learning to where they build support for each other, and then that peer group relationships, and then supervision, getting the supervision and really supporting them from that angle. And really, as they become clinicians and researchers and then policy developers, they have people around them that can support them and believe in them and know that they can do the work and that they can be successful. We're looking at student success as well too. So I just get so excited talking about this. So thank you so much for the question.
Thank you, Alberta. That was really good. We don't do a ton of that transition to higher education. As I mentioned, ours is a bachelor's program. And so we do try to encourage our students. We expose them to a lot of different nursing avenues when they're going through their clinicals. And then we work with other facilities to do residencies where they can do a training into a specialty of nursing. I feel the idea of graduate nursing degrees and advancing their nursing degrees beyond a bachelor's level is, I don't want to say new, but newer than in, I think also just realizing, helping the students realize they can move on past. I mean, the transition from an associate's, it was a big deal for them to get a bachelor's after the associates. So now we're then taking that transition into what can they do beyond their bachelor's degree. And so we've worked with other places. There is a college out of Great Falls, Montana, that offers a 1 year degree after they have a bachelor's in nursing and a master's, and then they can automatically go into their doctorate and get their DO. So we kind of work with recruitment there. And then we just try to encourage them to seek the avenues. There's so many advanced nursing degrees now. And just to continue, we have many students that go on to get their nurse practitioner through the Montana State University. So we've revamped our bachelor's program to include all the sciences they need for those kinds of advancing degrees. It's, I think just that transition is something that's newer. And then just that exposure of, when they go into clinicals, seeing all the avenues of nursing, and it doesn't just stop at the bedside, although bedside is very important too. But there's opportunity of growth and advancement. So.
All right. Thank you all so much. Just to reflect here a little bit, collectively, you really touched on the importance of, bringing in those former graduates or alumni or Native professionals working in the field to share their story. And story is so very important and such a traditional form of communication in our communities that it resonates with everybody. And developing those skills, how to develop a CV, how to develop a bio sketch, how to develop a resume. What do those things look like in practice? And sometimes it can be so simple just to forget, those very practical skills that our student relatives need as they're moving along their pathway. And then again, the relatives' roles. And another thing I appreciated that you all brought up is this idea around specialized fields, or these other fields that are popping up, and being inclusive and responsive. And that's a whole nother chore, is like making sure that everything transfers right, and articulation agreements are in place, and that students are set up for that pathway, and that it's available. And so that's a whole nother level. I mean, it's so great to hear that that's happening as well. And so today, I think, we're wrapping up here in a couple minutes, but and then the other thing is the consultation policy. I wanted to touch on that. There's a handful of them across the nation. I think around maybe 10. University of North Dakota is currently working on one as well, and they're working with the tribal nations or appointed official to get that in place. And so it's nice to see that those agreements are being put in place. I think that's so very important as well. But we will be wrapping up here in a minute. And so I just want to go around the circle one more time and, let you share any last thoughts and close out in a good way. So, Cherith.
Well, I just thank you for sharing this time. And I will say that this is a work that cannot be done alone. Collaboration is incredibly important. Our Native American Center of Excellence team has been able to organically form wraparound services, from tutoring to mentorship to mental health, wellness, social services. And especially, once again, we lean on that spirituality, the cultural connections, the extended family creation that are so critically important to help support and create that safety net around our Native students, knowing that our students may not have a traditional pathway, and that's okay. Being able to continue to encourage them and to work with them as they move through maybe more of a zigzag pattern to get to their goal and their destination. And I think that's important to recognize. Thank you so much, Alberta.
Yeah, you've mentioned a broad area. I just want to speak to one area is the mental health, the self-care. When students really are out there working toward their degrees, it's really important to encourage and emphasize self-care, that they get rest and they get the nutrition, good nutrition, and just many dimensions, their spirituality, their creativeness, continue those areas, because that in itself balances out. You're involved like with I utilize the spiritual wheel, as well as the Dene philosophy of self-care, that really I even use the SAMHSA model, the different dimensions that we can look at when we look at self-care. It's so important to take care of yourself, and then also being able to just continue on the practices that you do for yourself, that involve spiritual, whether it's smudging, singing a song, drumming, those are all important. And then we look at life stages. A lot of us are at the age where we're raising families too. And you can, by balancing your schedule and your roles, you can raise children. I during my PhD, I was having babies. I was nursing my babies, and I was providing daycare. My sisters were helping me take care of my kids. So my husband and I, we had 6 kids, and it's doable. You manage your time. You also know in your heart, in your mind, that what you want, and you follow that, and your support structure around it, so you can still integrate a lot of your family. And then also, when we look at mentorship or how we help people, each of us here are helping. We want to be able to be part of the next student becoming successful. And I think it's a 24-hour job, everyday job. I wear mine 24 hours. I don't limit. If I have a mentee, I don't limit it between 8 and 5. I say, whenever you feel the need, call me. As a result, I might get a text message 3 o'clock in the morning. Yes, I hear it. I feel it. Okay, let me look at my phone. Let's see who's calling. Sometimes there's a message there. Can you call me? So it's reaching out, taking care of each other, that love and that support, and that truthfully, that's how we help. And that's how we were helped, and we got into the positions that we're at. And Creator has this, journey for you that you follow. And with all your heart, with all your strength, you'll get there. Thank you so much, if you have.
Yes, I already have some great things to say as far as that goes. I think it just kind of comes back to what Linda was saying, where our students aren't always, maybe they didn't have the strongest foundation through their high school or education. And so just creating that welcoming family, spiritually centered environment, the supportive environment to kind of help them get where they need to go. If they need to be meeting them, being available to them, that's definitely a big one. That open communication. We have a lot of students that if they don't feel they get a response right away, it creates one of those barriers, and you have to then work harder to break through those barriers. So just being their support system, seeing their successes and helping them achieve those successes. So, but I thank you for the time today.
Thank you all so much, Chimigwich, and we'll close here, and I'll pass it back over to Sarah. But I just feel so very privileged to have spent time with you ladies today. So I learned too, and I'm going to walk away today just thinking about how important it is that we continue to take care of not only ourselves, but always to be there and take care of one another. So I hope you all have a wonderful day.